Okay, so next I'll show you how to adjust it, the friction with MRF brackets with different arterial combination. So first, please not use this one, not this. Just take the brackets of upper 4, because most of the patient you extract upper 4s, right? So we use upper 4 brackets. Take out 4 brackets. And be careful. Upper 4. And everyone get this 014 night-high archware. And use 20 ligature archware, lecture wear 20s. So smaller ligature, small archware, and tighten. When you tie these brackets, don't be afraid. Just tie it very tightly, very tight as possible. Because when you tie it, you lift up the ligature, and then you get more clearance. So, 014 night-high archware and 1 MRF brackets, and the ligature wear is 20s. You can feel the friction. Okay.我觉得还挺紧的，我怎么觉得给我的这个还蛮紧的？这个是，你给我的是那个14的4吗？
是，这个是18的，那个是14的。
因为这样我印象里就很，其实它很松的。我印象里它是可以，它其实可以甩的。不能完全甩，但它很松。怎么样？
你再扎一个18的，然后用25的扎一个，然后去比较。
比较一下，对。
扎一个就行。
对。这是个18的，给我一个25。And next, we use the 018 nighttime wear, and 25 lecture wear. And then you can feel the difference. We use another brackets of 4, upper fourth. "反正是有不同，对，你看着他们差不多扎完了，对，可以等一会儿。那个25的丝带给我一个，
哪个大？
这个吗
这个是
？25的，
硬的，
对。
现在也卷的习惯了。
嘿， So, have you feel the difference of the friction? 014, very easy to move. And 018 with 25 lecture wire is difficult. It's very tight. You can see it's quite tight. Can you feel the difference? After try the 014, try 2018 next. 018, 014.
差不多了。
I see most people have finished the ligature. Then we do the bonding of brackets. So for the first stage treatment, we only bond canine to canine and first molar buccal tube. We already bond the first molar buccal tube. Now we bond the canine to canine bracket. The way of bonding brackets is just the same as straight wire. You put the brackets at the center of the clinical crown or FA point, facial access point. Okay? Let's do this.
Yes, yes, thank you. Excuse me. They want to use their computer, not this. So how I do? I just turn off this machine. They want to link their computer, their laptop. How to do it? Sorry. So just
เขาจะย้ายโต๊ะไปตรงนู้นครับ
อ๋อขยับโต๊ะ
ใช่ใช่ใช่
เพราะอะไรครับ ผักอะไร
อ๋อเขาจะใช้สายตุ่มหรือว่าตรงนี้ไม่ต่อได้
ได้ใช้พร้อม
อันนี้ก็ต่อได้แค่ถอดคอมออกก็ใช้ได้
อ๋อ
พี่ก็ถามอยู่ว่าจะมูฟพร้อมไหมพูดเลยก็ไม่รู้
ทีนี้เขามาถามหน่อยว่าเอาอะไรกันเนี่ย
we will use again this thing. Yeah, no move.
เจ้าหนู
Yeah. Okay.
来演示那小伙子，我看他应该做的
行。
是吧？就感觉14的好像没差那么多，但18的确实还就是紧一点。14的之前用12的来试的时候就
12肯定就晃荡了。
对，就能感也能肯定有差别吧。
OK。
刚才有，现在没有。
什么意思？
它这是影像。哎，说出来了。
那等我不是老师等我不用发撕给他们，还得给他们发吗？我
就用刚才那个他们那个14的撕就行。
就直接在那个粘托层、
对，用那
穿
根
脱层的上头。
对，就用那根撕就可以。
第2副的这个东西
也有的。对，我
下。这样会掉出来。你们这是哪个牌子的呀？福特的还是西亚？西亚也做这个。哎，那我那天说让他们给我买一个，他们居然没买到。你们也做这个啊？
就可能买点，就是
我在我那个诊所，我说我要买一个这个，他居然没买到，然后我又去打听哪个好，我觉得你们家那边特的好。
老师傅吧，你要什么情况发我回去跟他们说。
反正我知道这是辛辣的，
主要现在是人民币它比较
嗯？嗯？嗯？Very well. Check. Yeah. Maybe I could change your laptop. Hey. Okay. Okay. Seems okay now. 信号不太好，我这个好像老断。这个信号好像在。哎，现在可以了。
但是不行，我用姜老师，哎，看看一下。
是他那个。
换电脑吧，对，换姜老师电脑好了。OK，maybe。Let me check. 转接头是可以的，就是我的 U 盘，我的激光笔好像。好 ，It works. Thank you.
Okay, I'm sure that everybody has almost completed their bracket placement. And while we wait for the glue to dry, we have another important lecture on clinical application of MLF brackets by Dr. Gui Chen. So just to give a brief introduction, Dr. Gui Chen is a distinguished member of the orthodontic department of the Peking University Hospital of Stomatology and is renowned for his expertise in orthodontics and made significant contributions to the field through his research and clinical practice. He has been actively involved in various studies, including research on the orthodontic treatment of substituting third molars for missing permanent molars and the measurement of three-dimensional changes in lip vermilion in adult female after orthodontic extraction. His works has been published in several reputable journals showcasing his dedication to advancing orthodontic knowledge and techniques. As a dedicated educator, Dr. Chen has also mentored numerous students and colleagues, sharing his wealth of knowledge and experience. And his commitment to excellence and patient care has earned him recognition and respect within the orthodontic community. Please give a warm welcome to Dr. Gui Chen.
Thank you. First, I want to thank you, Dr. Lin. He is the bridge connecting NU and PKU. And so our friends and communication starts in 2003. Yes, Dr. Pierpont invited Dr. Shu and me to visit your department. And in the last year, Professor Pierpont visited our department, our school, and have an in-depth discussion with Professor Xu. And that's why we are here in 2025. And I really hope our friendship, our communication will keep going on. So today my topic is clinical application of multi-level low friction brackets. In clinical practice, anterior clouding is very common. Usually we can see the crossbite of right low incisor, rotation of middle incisor, and high position of canine. In this lesson, we will discuss how to use MLF brackets to adjust the friction and quickly align the teeth. Let's give a typical example of friction. This is a high position canine because of the crowding. So during the process of aligning the canine, the canine will move downward and the archwire will sliding backward. Whether the archwire can slide smoothly, that means with low friction. It is very important for the speed of the canine alignment. Let's see the picture again. Yes, as the canine go downward, the archwire slide along the slot of the bracket. So these teeth, we want the friction here very low. And Professor Kusi classified the sliding resistance into classical friction, binding, and notching, according to the theta and theta C. Dr. Jiang has introduced this part. Sliding resistance is the sum of the classical friction, elastic binding, and physical notching. Classical friction and binding is equal to the normal force applied by the regulation multiplied by the coefficient of the friction. Then who is the dominant resistance during the alignment? Is notching or elastic binding? As we know, physical notching rarely occurs in nitrile wire. So The elastic binding is the dominant resistant in alignment stage. Then how to reduce binding during the alignment stage? Binding is equal to the normal force multiplied by the coefficient of friction. Research has shown that normal force is positively related with elastic modulus, the moment of inertia, and the constraint angle of the arch wire, which means theta minus theta c, and negatively correlated to the width of the bracket and the inter-bracket distance. Then we know how to reduce the normal force of bind. We just increase these parameters and decrease those three parameters. Let's see the elastic modulus first. We all know that the elastic modulus of nitrile wire is smaller than that of TMA, which is smaller than that of stainless steel wire. In order to reduce the binding during the alignment stage, it is recommended to use nitrile wire in initial stage of alignment. Then let's take a look at the moment of inertia. Moment of inertia is the property of the cross-section resisting bending related to the dimension and the shape of the cross-section of the wire. If the radius of arch wire A is twice that of the arch wire B, then the moment of inertia of arch wire A is 16 times that of arch wire B. Therefore, during the alignment stagement, we should choose the thin arch wires. Then let's see how to reduce theta minus theta c. It's very easy. We can either reduce the theta angle or formed by the arch wire and the slot, or increase the theta c. Let's see a usual case with linearly positioned upper right lateral incisor. When an arch wire is engaged into the slot of self-ligating blankets, we get a wire slot angle theta 1, which is greater than the critical clearance angle theta c. When the arch wire, when we change to MLF brackets, and the arch wire is inserted into the MLF blankets, and only distal wings of the blankets of the upper right lateral incisor was ligated, we get another angle theta 2, which is smaller than theta 1. Then we decrease the normal force. Dr. Jiang already told us how to increase theta c. This is how MLF blankets was designed. By cutting two yellow pieces of the outer wall of the slot, we increase the slot size in the first order dimension. Let's look at the fourth parameter, the width of the brackets. Usually we can't change the width of the brackets. We know the larger the bracket width, the better the elasticity of the arch wire, and the smaller the normal pressure. Let's see the last parameter, interbracket distance. Interbracket distance is the distance between the center of two adjacent brackets. However, the effective interbranchial distance is related to the ligation method. So how many ligation methods do you use in clinical? We can see that the two upper middle incisors were ligated in different ways. I'll show you several ligation methods. This is full ligation, right? And this is diagonal ligation. This is single wing ligation. And this is figure 8 ligation. Because it's no ligation. Sometimes we don't need a ligation. So first, let's take a look at the full ligation. And the distance between the blue solid line is the effective interbranchial distance. We use this most, I think. This is the diagonal ligation, and the distance between this is the effective interbranchial distance of the full ligation. And the blue, and and this is the effective interbranchial distance of the diagonal ligation. When the teeth is rotated, usually we use single wing ligation. This is a single wing ligation, and whose interbranchial distance is much longer than diagonal ligation. This is the figure 8 ligation, and we will get a much longer interbranchial distance. And when the teeth is well aligned, sometimes ligation is not necessary, and we get the longest interbranchial distance among the 5 ligation methods. Summary. So how to reduce elastic binding? We can choose night wire of the smaller size. Then we can decrease the elastic modulus. We can decrease the moment of in the tear. And we can choose reasonable ligation method. Then we can decrease the theta angle and increase theta C. And we can increase the effective interbranchial distance and adjust the normal force. Then let's take a look at the clinical use of MLF brackets. These are the ligature rings used in clinic. You know, children like colorful rings. These are the stainless steel ligation wire used in clinic. We have 0.2, 0.25, 0.3 millimeters. And in MLF blankets, the largest passive distance is about 0.65 millimeter. Blue color means clearance exists between the arch wire and the blanket's slaughter wall, which is a passive configuration. And the red color means the arch wire received pressures and is in an active configuration, while the white color means a borderline configuration. Let's see some ligation techniques. So for the first ligation technique is reduce the friction during initial alignment. Here we classify the friction into two types. One is the friction of a single teeth, and another one is a systematic friction, which is the sum of the sliding resistance in whole arch. Let's see the friction of a single teeth. When we pull a canine backwards, only this canine has friction. No arch wire sliding happens. However, when a line rotated and middle incisor, in extraction case, let's pay attention to the end of the arch wire. When the teeth aligned, we can see the end. We will find that the end of the arch wire become longer. See the yellow part, which means all the teeth contribute frictions. Let's see it again. This is a situation where the maxillary lateral incisor are mal-aligned in the lingual direction. During the alignment process, the arch wire slides and all teeth contribute to the friction force. We have seen this before, like the high position the canine during the process of aligning high position canine, the arch wire sliding back. And in this situation, the main contributors to the friction, to the systematic friction, are the posterior teeth. So how can we reduce the systematic friction? We have three methods. First is to reduce the points where friction force are generated. Second is correcting mal-aligned teeth in a step-by-step way. Third is reduce frictional force of well-aligned teeth. Let's see the first method first. Usually, all the teeth were bonded at once when using straight wire appliance or self-ligating wires, self-ligating appliance. So there are 14 friction points in the upper arch. However, in the first stage of pass technique, only 6 anterior teeth are bonded and the first molar banded, which has 4 fewer friction points than a straight wire appliance, and pass will align the anterior teeth quickly. So the systematic function force is the sum of the functional force of all the teeth. If we don't bond the second premolar and the second molar at the first age, our systematic friction will be low. Let's see the second method to collect malaligned teeth in a step-by-step way. As we know, the dominant frictional resistance exists in the most malaligned teeth. When the largest deformation of the arch wire happens, and the theta angle is much larger than theta C angle, it is the point contributing the maximum binding. Let's take a look at the upper dentition. First, we grade all the crooked teeth, the upper right, middle incisor, and left lateral incisor are severely rotated teeth, and upper right lateral incisor and the left second premolar are moderate crooked teeth, and the right premolars are mild malocclusioned. During the alignment process, first, we divide it in 3 steps. We first partially align the 2 severely crooked teeth to make them moderate malaligned, and then treat the 4 moderate crooked teeth to make them mild crooked. And finally, we align all the teeth together. We don't align all the malaligned teeth at once. The benefit of this method is to always keep the systematic friction at a low level. Let's see the third step. Third method is to reduce the friction of well-aligned teeth. That means we keep the well-aligned teeth in a passive condition when we correct the severe crooked teeth and let the arch wire slide smoothly. Let's see some case. This is a class 1 clouding case. Yes, we can see severe clouding in the upper arch. We didn't bond second premolar. We didn't bend we didn't bend the second molar, and no friction at these teeth. That's method 1, and it's the usual way past technical do in the first stage. No bonding, no bending. In this case, the lower right middle incisor was not bonded, which reduced the point of friction. Also, it increased the interblanket distance and decreased the normal force and the BI. Let's take a look at this case. The upper left lateral incisor was severe malaligned, and we use diagonal ligation on the lateral incisor to correct it step by step. We can see the arch wire is not engaged into the slot folio. After 1 month, we almost finished the first stage of alignment. In this case, we can see only left lateral incisor was malaligned. Other teeth were well aligned, so all the upper teeth were ligated in a diagonal way except upper left lateral incisor. Another case, a 13-year-old girl, class 1 molar relationship and severe rotated upper middle incisor. We bond the past appliance from K9 to K9 and first molar XBT tuber. She came back 4 days later because of the debonding of because of the failure of one blanket. I'm really surprised with the result and take a picture, take a photo. We can see after 4 days, the upper middle incisor almost well aligned. It's very quick. Let's see how we ligate, how we use the ligation method. In the middle incisor, we use for the rotated middle incisor, we use single wing ligation. And the other teeth, which were well aligned, we just use diagonal ligation to decrease the friction. We can see the marks on the rim of the bracket, which means the brackets were bonded recently. Yes, the single wing ligation for the rotated teeth and the diagonal ligation for the well-aligned teeth to decrease the friction. Let's see the ligation technique 2. How to increase the precise control of teeth after the alignment. Let's see the solution of self-ligating blanket first. Initial alignment, And usually passive self-ligating brackets use square nitrile wire to eliminate the clearance between the arch wire and the slot to achieve precise control of teeth movement. The square arch wire, yes, the thick square arch wire may cause some discomfort. Then let's see the solution of MLF brackets. Paths achieve the precise alignment using the thin nitrile wire. The only requirement is that the combination of the arch wire and the ligature wire is in an active configuration. Then we can control the teeth movement. Summary of the ligation strategies. In the early alignment stage, we want to reduce the systematic friction and keep the system, always keep the system at a low friction level throughout the entire alignment phase. Here, we want the level here. And use physiological force to quickly align the teeth. In the later alignment stage, we want to achieve precise control of teeth during the thin wire phase, facilitating the effective of light force from the thin wire throughout the entire alignment phase, and allow the orthodontist to consistently control friction, balance rapid teeth movement with precise control, thus achieve the individualized treatment. It is said that there are no two identical leaves in the world. And we can also say there are no two identical malocclusion in the world. So we need an appliance that can adjust the different parameters to adapt to different malocclusion. That's why we choose MLF blankets and learn how to use it. Thank you.
Okay, Professor Chen, Professor Jiang introduced the structure of the MLF bracket, and you already bound canine to canine, right? Now we do the first stage treatment. The first arch wire usually we used 014 nitrile wire. So I show you how to insert this 014 nitrile wire, and you then can practice how to navigate on each bracket according to the theory they just introduced, okay? Give me a, oh, yes. 114的裂态，把这个打开。
他们等会儿给他们一人发一个。
你给我一个上颌的吧。
可以。
上颌。我给他们把上颌下颌我都要吧，再给我一个上颌。念上了吗？
有了。你拿了一根新的丝儿是吧？
对，我要个上面的。
上的是吗？
对，上面14的2014。
后面能烧掉吗？
So for the first stage treatment, we bound 4 buccal tube and canine to canine bracket. And the first wire is we usually use the 014 line tie wire. And the first wire inserted to the minus 25-degree round tube, like this. Can see the buccal tube, and this side same. Then you will see the arch wire is above inside the bracket. Ooh. 能看见吗？ You can see the position of the arch wire. It's gingival to the inside brackets. I don't know if we can see the points, the mark on the middle of this arch. If you can see the mark in the middle of upper arch, we move it to one side first. So not in the middle, but shift to one side, like left side. Shift to the left side first. Then I cut the arch wire and just leave about 3 millimeters, like this. Then we do the distal and bending like this. In this way, the wire cannot slide. You see this, right? Then you shift the wire to the other side. Ooh, this bracket. Not dry. I bound it again. Okay. Now we shift the wire to the right side and leave 3 millimeters behind the round cube. Cut the wire. Then I use the bend back plier to make another bend like this. So in that way, the wire cannot shift to both sides. Okay? Then it will not poke patient's buccal soft tissue. Since the bracket has not fixed, so I cannot navigate it right now, but you can do it. Now I do the lower wire. Lower wire will go into the mesial entrance and go through the slot on the occlusal wall of buccal tube. So now you see the wire in the anterior. You see the position? It's gingival to the incisor bracket. Same thing here. You can find a mark in the center, but you shift it to one side first. Then leave about 3 millimeters, cut the wire. Then you use bend back plier to bend the distal end. Then you shift the arch wire to the other side. And leave about 3 millimeters, cut the wire. Then you need bend back plier to make another bend like this. Now the wire cannot move to either side. Then we can engage the wire into brackets. Then we do the ligature. We have 2020的这张是 ligature wire。So usually we use 020 ligature wire in the first stage. Why? Why we choose 020 ligature wire in the first stage? because it's very crowded. After we extract first premolar, we want canine to move back automatically. So we need low friction. So we choose O2O ligature wire and to tie the distal wing of canine. So that's the single wing ligature as Dr. Chen just mentioned. Single wing. Thank you. Then the other side, same thing, because we want this canine slide back with lower friction. So we use distal wing single wing ligature. Okay, then you need to decide what kind of ligature you use for the incisors. We usually use the mesial wing ligature on central incisor. Why mesial wing? Why we choose mesial wing? Now I choose mesial wing. Why? Because when you choose the mesial wing, this distance is larger. That's the interbracket distance is larger. If I use distal wing, the distance is shorter, right? So we choose the mesial wing. And this incisor is difficult to engage. So I'll choose distal wing. In that case, the wire deform less. Then if I choose the mesial wing. So for this tooth, I choose distal wing. So it depends on your malocclusion. Oops. It's usually difficult to do it on the typodon than in real patient's mouth. Okay. Now the left lower natural incisor. This one has a little bit of rotation. So I choose to negate the mesial wing, single wing. If you see from the occlusal view, the lateral incisor a little bit rotated. So if I negate this wing, next time this tooth will be corrected. Now, this lateral incisor, the right lateral incisor, is far from the arch wire. For this case, we should not engage the wire. So we do we do a very special ligature like this. You can see. We just suspend this tooth like this. Not fully engaged in, but just give it a little bit force. You see the wire deformed a little bit. So in that case, you don't have a heavy friction, but you still give those tooth a little bit of force to pull it labially. Then you cut those ends. Now you do it yourself. You decide which tooth use single wing, which tooth use double wing. Okay? If you have any questions, our instructors will answer your questions. Let's do it.